In a world filled with nutrients and vitamins, meet vitamin A, the unsung hero that is essential for our health and well-being. What makes this nutrient so special? From promoting healthy vision to supporting immune function, vitamin A is like the superhero we all need in our lives. But wait, there's more. Do you know that vitamin A can also keep your skin glowing and your bones strong? But where can we find this superhero nutrient? Look no further than the vibrant colors of fruits and vegetables, such as carrots, sweet potatoes, spinach, and kale. Remember, with vitamin A by your side, you can conquer any health challenge that comes your way. Stay strong, stay healthy, and unleash the superhero within you. What is vitamin A? Though vitamin A is commonly regarded as a single nutrient, it is actually a collection of fat-soluble molecules that include retinol, retinol, and retinol esters. Food contains two different types of vitamin A. Preformed vitamin A, retinol and retinol esters, is found only in animal goods like dairy, liver, and fish. But provitamin A carotenoids are prevalent in plant foods like fruits, vegetables, and oils. 3 trusted source. To use both of these forms of vitamin A, your body must convert them to retinol and retinoic acid, which are the vitamin's active forms. Because vitamin A is fat-soluble, it is stored in body tissues for future use. The majority of vitamin A in your body is stored in the liver in the form of retinol esters. Functions in your body. Vitamin A is needed for good health. It promotes cell growth, immunity, fetal development, and vision. One of the most well-known effects of vitamin A is its effect on eyesight and eye health. Retinol, the active form of vitamin A, combines with the protein opsin to generate rhodopsin, which is required for color vision and low-light vision. It also protects and maintains the cornea, your eye's outermost layer, as well as the conjunctiva, a thin membrane that covers the surface of your eye and the inside of your eyelids. Vitamin A also helps to preserve surface tissues including your skin, intestines, lungs, bladder, and inner ear. It improves immune function by promoting the formation and distribution of T cells, which are white blood cells that defend your body from infection. Furthermore, vitamin A benefits skin cell health, male and female reproductive health, and embryonic development. Food sources. There are numerous dietary sources of both preformed and provitamin A carotenoids. Preformed vitamin A is more easily absorbed and utilized by the body than plant-based provitamin A carotenoids. Many factors influence your body's ability to convert carotenoids, such as beta-carotene, into active vitamin A. These include heredity, food, overall health. As a result, persons who eat plant-based diets, particularly vegans, should be cautious about consuming enough carotenoid-rich foods. Foods highest in preformed vitamin A include egg yolks, beef liver, butter, cod liver oil, chicken liver, salmon, cheddar cheese, king mackerel, trout. Foods high in provitamin A carotenoids like beta-carotene include sweet potatoes, pumpkin, carrots, kale, spinach, collard greens, winter squash, cantaloupe, papaya, red peppers. Health benefits. It is a potent antioxidant provitamin A. Carotenoids such as beta-carotene, alpha-carotene, and beta-cryptoxanthin are vitamin A precursors with antioxidant characteristics. Carotenoids protect your body from free radicals, which are extremely reactive chemicals that cause oxidative stress. Oxidative stress has been related to chronic illnesses like diabetes, cancer, heart disease, and cognitive loss. Carotenoids-rich diets are linked to a lower risk of a variety of illnesses, including heart disease, lung cancer, and diabetes. It helps maintain good vision, especially in low light, so you can spot that cute doggo across the park even at dusk. Plus, it strengthens your immune system, so you can fight off those nasty bugs and stay feeling top-notch. It is essential for maintaining eye health and preventing macular degeneration. As previously said, vitamin A is crucial for vision and eye health. Adequate vitamin A intake can protect against certain eye illnesses, such as age-related macular degeneration, AMD, According to studies, having greater blood levels of beta-carotene, alpha-carotene, and beta-cryptoxanthin can reduce your risk of AMD by up to 25%. This risk reduction is connected to carotenoid nutrients' ability to preserve retinal tissue by reducing oxidative stress. It may protect against some malignancies. Fruits and vegetables high in carotenoids may protect against certain cancers due to their antioxidant effects. For example, a research of more than 10,000 adults discovered that smokers with the greatest blood levels of alpha-carotene and beta-cryptoxanthin had a 46% and 61% lower chance of dying from lung cancer, respectively, than non-smokers with the lowest consumption of these nutrients. Furthermore, test tube studies show that retinoids may impede the growth of specific cancer cells, including bladder, breast, and ovarian cancer cells. It is vital for fertility and fetal development. Vitamin A is required for both male and female reproduction because it promotes sperm and egg formation. It is also important for placental health, fetal tissue formation and maintenance, and fetal growth. As a result, vitamin A is essential for the health of pregnant women and their developing offspring, as well as those trying to conceive. It boosts the immunological system. Vitamin A improves immunological function by triggering reactions that protect the body from disease and infection. Vitamin A is involved in the development of specific cells, such as B cells and T cells, which play critical roles in immunological responses that protect against disease. This vitamin deficit causes an increase in pro-inflammatory chemicals, which reduces immune system responsiveness and function. Deficiency. Though vitamin A deficiency is uncommon in industrialized countries like the United States, it is frequent in underdeveloped countries where people may have limited access to food sources containing preformed vitamin A and provitamin A carotenoids. Vitamin A deficiency might result in serious health consequences. According to the World Health Organization, vitamin A insufficiency is the most common cause of avoidable blindness in children globally. Vitamin A deficiency also heightens the severity and danger of death from illnesses such as measles and diarrhea. Furthermore, research has shown that vitamin A deficiency increases the risk of anemia and death in pregnant women, and has a negative influence on the fetus by decreasing growth and development. Less severe symptoms of vitamin A insufficiency include hyperkeratosis and acne. Premature newborns, people with cystic fibrosis, and pregnant or breastfeeding women in impoverished nations are at higher risk of vitamin A insufficiency. Toxicity and dosage recommendation. Just as vitamin A deficiency can have a detrimental impact on health, too much can be deadly. The RDA for vitamin A is 900 microgram per day for men and 700 microgram per day for women. This intake level is easy to meet if you eat a lot of whole foods. To avoid toxicity, adults should not exceed the tolerable upper intake level of 10,000 IU, 3,000 microgram per day. Though it is possible to absorb sufficient preformed vitamin A from animal sources such as liver, toxicity is most usually associated with excessive supplementation and therapy with certain drugs such as isotretinoin. Vitamin A is fat-soluble, so it is stored in your body and can accumulate to harmful levels over time. Taking too much vitamin A can have serious negative effects, even death if consumed in large enough concentrations. When an extremely large dosage of vitamin A is eaten in a short period of time, acute vitamin A toxicity develops. Chronic toxicity occurs when doses greater than 10 times the RDA are consumed over a lengthy period of time. The most common side effects of chronic vitamin A toxicity, often referred to as hypervitaminosis A, are vision disturbances, joint and bone pain, poor appetite, nausea and vomiting, sunlight sensitivity, hair loss, headache, dry skin, jaundice, delayed growth, decreased appetite, itchy skin, liver damage. Though less prevalent than chronic vitamin A toxicity, acute vitamin A poisoning causes more serious symptoms such as liver damage, elevated cranial pressure, and even death. Furthermore, vitamin A intoxication can have a severe impact on the health of pregnant women and their offspring, perhaps leading to fetal development anomalies. To avoid toxicity, stay away from high-dose vitamin A pills. The UL for vitamin A applies to both animal-based food sources and vitamin A supplementation. A high intake of dietary carotenoids is not related with toxicity. However, studies correlate beta-carotene supplements with an increased risk of lung cancer and heart disease in persons who smoke cigarettes. Since too much vitamin A can be harmful, consult a healthcare professional before taking vitamin A supplements. Don't forget to hit that like button, subscribe for more health tips, and share with your friends who could use a little vitamin A boost in their lives. Until next time, stay healthy and keep shining like the star that you are. See you in the next video.